Okay, so talking about the back of forearm, it's a little complicated. Okay, back of forearm, you have many muscles. Okay, like extensor digiti minimi, extensor digitorum, extensor indicis, extensor carpi radialis longus, brevis, brachioradialis. You have the spinator, many muscles. Okay, we'll come to everything one by one. Okay, just in front of your radial tuberosity, right, medially, there is some attachment of the supinator, okay, in the radius. Just told this because in the previous video I missed this attachment. Achha. Now talking about your humerus, your ulna. Okay, ulnar anterior surface আমি কি বললাম তাহলে anterior surface এ তোমার থাকবে হচ্ছে 1/4 পার্টে pronator quadratus, right? Your supinator is present in the supinator crest, right? এটাই থাকবে anterior surface এ, বেশি কিছু নেই। Okay, your posterior border gives attachment to your flexor digitorum profundus, flexor carpi ulnaris, and another muscle which is the extensor carpi ulnaris. Okay, it also helps in your extension of wrist. Okay, adducts the wrist. Its nerve supply is by the ulnar nerve, and it has also an attachment on the lateral epicondyle of the humerus. All the extensor muscles of the back of forearm, they have the common origin from lateral epicondyle of the humerus. Okay, these are the things to be remembered. Yes, now I remembered one thing. Your anterior surface of the ulna, okay, the 3/4 part of the anterior surface of the ulna gives attachment to flexor profundus, flexor digitorum profundus. Okay, keep this in mind. I might not have told you this in my previous video. Okay, another origin of flexor digitorum profundus is from your anterior surface of ulna. Okay. Okay, now this is all about the anterior surface. Your posterior border হয়ে গেল, okay, anterior border হয়ে গেছে, right, and lateral border হয়ে গেছে. So talking about your medial surface, the medial surface and the anterior surface meet up after the anterior and posterior borders join. Okay, now the posterior surface, medial surface আর কিছু নেই তো, দাঁড়া একটু ভেবে নিই, না কিছু নেই, মনে পড়ছে না, মনে হয় কিছু নেই। Talking about the posterior surface, okay, posterior surface, it is divided into an upper compartment and lower compartment. Upper compartment কি আছে? Upper compartment has the attachment of anconeus muscle. Okay, it's a back muscle, back of forearm muscle. You have the lower compartment, okay, then in the lower compartment it is further divided into medial, small medial and large lateral parts. Okay, the medial part is traversed by extensor carpi radialis, okay, sorry, extensor carpi ulnaris. Okay, the medial part is traversed by the extensor carpi ulnaris, right? And the lateral part, large lateral part, it gives attachment from above downwards to abductor pollicis longus, extensor pollicis longus, and extensor indicis. Okay, all the muscles in your back of forearm are supplied by the posterior interosseous nerve except the brachioradialis and extensor carpi radialis longus ECRL, which are supplied by the radial nerve. Okay, keep this in mind. So this is all about your posterior border. Good. Coming to the lower part. Lower part, your a groove is present between the styloid process and the head of ulna, which gives attachment to the extensor carpi ulnaris. Okay, which provides another origin of extensor carpi ulnaris. Okay, provides attachment to extensor carpi ulnaris. Your head of ulna gets attached to the ulnar notch of the radius, which is present here. Okay, to form the inferior radial ulnar joint. The articulating disc, it is attached to the styloid process and the undersurface of the head of ulna, right? And thus this ulna does not actually participate in the formation of wrist joint, right? Because it is covered by the triangular articular disc. These are the attachments which I had to talk about. I hope I have not missed any more of it, right? Coming to your radius. Okay, কি বলেছি আপাতত রেডিয়াসে? ট্রাইসেপস বলে দিয়েছি, অ্যানুলার লিগামেন্ট বলে দিয়েছি, তোর কোয়াড্রেট লিগামেন্ট তো বলেই দিয়েছি। ওইদিকে অ্যান্টেরিয়র বর্ডারে ফ্লেক্সার ডিরেটম প্রফান্ডাস বলে দিয়েছি। অ্যান্টেরিয়র সারফেসের 1/4 পার্টে কী অ্যাটাচ হচ্ছে সেটাও বলে দিয়েছি। অ্যান্টেরিয়র সারফেসের আরও অন্য পার্টে কি, মানে 3/4 আপার 3/4 পার্টে। আচ্ছা, অ্যান্ড আবার বলে দিচ্ছি, অ্যান্টেরিয়র সারফেস, অ্যান্টেরিয়র বর্ডার is oblique. Okay, the upper oblique part gives attachment to the flexor dilator profundus, while the lower part gives attachment to the extensor retinaculum. আসছি পরে। Your upper 3/4 part of the anterior surface gives attachment to the flexor digitorum, flexor pollicis longus. Okay, while just below it you have the attachment of, in the 1/4 part you have attachment of pronator quadratus. Okay, pronator quadratus is supplied by anterior interosseous nerve. ঠিক আছে, বেশ। This is the anterior surface. Talking about the posterior surface, which is present between the interosseous border and the posterior border. Yes, the posterior border is ill defined, present only in the middle part. Okay, this is the posterior border, and this posterior border gives attachment to flex the extensor carpi radialis longus above and extensor carpi radialis longus below, right? then oh sorry, no, भूल बोला, no, भूल बोला. In your posterior surface, abductor pollicis longus and extensor pollicis brevis are attached. Okay, I'm very sorry, I'm very sorry. It's not extensor radialis ওসব না, ঠিক আছে. It's the attachment is abductor pollicis longus above and extensor pollicis brevis, okay, below, right? Keep this in mind. Very sorry for this inconvenience, right? Now it's okay. Okay, now coming to your lateral surface. Here the lateral surface is related to the extensor carpi radialis longus and extensor carpi radialis brevis. Okay, yes, actually. Now I was actually remembering. I have told everything in correct order and all. It's very confusing actually. It's okay, you will also get used to it. Acha. So these are the muscle attachments on your posterior surface. Also the lateral surface is related to your extensor carpi radialis longus, extensor carpi radialis brevis. Coming to your distal part, okay, distal part, this is a dorsal tubercle of Lister. This is a dorsal tubercle of Lister, right? It has one groove on the lateral side, another groove, and two grooves on the medial side. Okay, here there is attachment of not attachment actually. Through here passes extensor extensor carpi radialis longus and extensor carpi radialis brevis. Okay, then medial to the dorsal tubercle of Lister you have the extensor pollicis longus which runs. Okay, then you have the extensor digitorum and the extensor indicis which is below it, within it. Okay, so from lateral to medial you have the extensor carpi radialis longus, extensor carpi radialis brevis, then you have the extensor pollicis longus, then you have the extensor digitorum, okay, the extensor indicis, okay, and below it are present the posterior interosseous nerve and the anterior interosseous artery. Okay, all these structures pass through the extensor retinaculum. Okay, the styloid process, the tip of the styloid process gives attachment to the lateral carpal ligament. The anterior surface, this part, gives attachment to the palmar radiocarpal ligament. Okay, the inferior carpal ligament, the inferior carpal surface has a lateral triangular area and a medial quadrilateral area. Lateral triangular area gives attachment to the scaphoid. Medial quadrilateral area gives attachment to lunate bone. ঠিক আছে? Okay, so hopefully you have understood all these things. Some important muscles are there. Okay, some important muscles are there in a superficial group. The muscles which are present are brachioradialis, very important muscle. Brachioradialis comes from another thing which I'm bol do. Yeah, brachioradialis, it comes from the upper 2/3 of the supracondylar ridge of humerus and gets attached to your proximal part, just to proximal part proximally to the styloid process are key, right, on the anterior border, just above the styloid process gets attached the brachioradialis. Brachioradialis is supplied by the radial nerve, okay, and it helps in supination from pronated forearm to mid prone position. Okay, supinates the forearm to mid prone position, from mid prone position, or pronates the forearm from mid to mid prone position. Okay, pronates or supinates, okay, to like 50%. Then you have the extensor carpi radialis longus and carpi radialis brevis. Extensor carpi radialis longus comes from the lower 1/3 of the supracondylar ridge. Okay, I think so it's lateral supracondylar ridge. Okay, and it gets attached to the dorsal surface of the second metacarpal bone, brevis. Okay, brevis gets attached originates from the lateral epicondyle and gets attached to the dorsal surface of the third metacarpal, right. The radialis longus is supplied by posterior radial nerve. Okay, it is supplied by the radial nerve. Then you have the extensor digitorum, extensor digiti minimi. Both arise from the common extensor origin of the lateral epicondyle of the humerus. Extensor digitorum, extensor digiti minimi are very similar. Okay, they get attached to the terminal and middle phalanges of the fingers. Okay, your extensor digitorum gets attached to the lateral three fingers, while medial to ED, extensor digitorum is extensor digiti minimi, which gets attached to the terminal and middle phalanx of the little finger. Yes, sir? And both are supplied by posterior interosseous nerve, right. As I said, all the muscles of the forearm, their action is extension, so you can write extension of wrist, okay, extension of the proximal interphalangeal joints for digiti minimi, for extensor digitorum, metacarpophalangeal joint, yes, extension in general. Anconeus muscle, it supplies by nerve to anconeus, which comes from the radialis muscle. Okay, anconeus has origin from the back of humerus to the upper part of the posterior surface of ulna, as I said, as I showed you here. Wait a minute, yeah, this part here gets attached anconeus, and it is a weak extensor of the elbow joint, right. Then you have the extensor carpi ulnaris. Extensor carpi ulnaris also arises, as I said, from the posterior border of the ulna, okay, by an aponeurosis. Also arises from the lateral epicondyle of the humerus and supplies by ulnar nerve, not radial nerve, and it extends the wrist and also it adducts the wrist along with the extensor, along with the flexor carpi ulnaris muscle. Okay, adducts the wrist, while extensor carpi radialis longus abducts the wrist along with the flexor carpi radialis. Okay, flexor carpi radialis. These are superficial muscles. Now coming to deep muscles. Deep muscles are key important ache. Supinator is a very important muscle. Supinator, it gets attached to the supinator crest. Okay, the supinator fossa also gets attached to the radial collateral ligament. Okay, and also gets attached to the medial surface of the radius, right? That's all about supinator. Supinator is obviously it's the principal muscle of supination, and its nerve supply is by the radial nerve. This is the original insertion of supinator muscle. It's an important nerve. It's an important muscle. Okay, very important muscle. Then you have your keyword again. You have given abductor pollicis longus. Abductor pollicis longus, it arises from the lateral part of your posterior surface of ulna, right? Abductor pollicis longus. Also, it arises from the posterior surface above upper part of the posterior surface of the radius. Okay, and gets attached to the metacarpal. Okay, the base of the first metacarpal bone helps in abduction of the thumb. Then you have extensor pollicis brevis. Extensor pollicis brevis, it is attached to the lower part of the posterior surface of radius, and it gets attached to the proximal phalanx of the thumb, right? Helps in extension of the thumb. Right, you have the extensor pollicis longus also. Okay, the extensor pollicis longus arises from the lateral part only of the ulna, right? And it gets attached to the middle phalanx of the thumb, right? Also helps in extension of the thumb. And you have the extensor indicis, right? The extensor indicis gets originates from your lateral surface of the ulna. Okay, lateral surface of the ulna, and gets attached to your index finger. Okay, the mode of insertion of extensor indicis, extensor digitorum, and extensor digiti minimi are exactly the same, just that extensor digitorum is for the lateral forefingers, while your extensor digiti minimi is for the little finger, and the extensor pollicis longus is for the thumb. Okay, and extensor digiti minimi and extensor pollicis longus lie medial to ED, right? Extensor digitorum. And all these muscles, the supinator muscle, the extensor indicis, okay, then you have the extensor pollicis brevis, you have the abductor pollicis longus. All these muscles are supplied, all the deep muscles are of the back of forearm are supplied by your posterior interosseous nerve. Yes, just that, yes, supinator is supplied by the radial nerve, okay, nerve through supinator, radial nerve. Nerve to supinator. So all this is about the muscles of forearm. Hope you have understood. Talking about the extensor retinaculum, it's present here. Medially, see, medially it is attached to the triquetral pisiform. Achha, one thing, in your flexor carpi ulnaris, I forgot to talk about one thing. The insertion is to the pisiform bone. Pisiform bone is a sesamoid bone, okay, keep that in mind. It arises from the flexor carpi ulnaris, okay. Also it gets attached to the hook of Hammett through the piso-Hammett ligament, and to the fifth metacarpal, base of the fifth metacarpal through the piso-metacarpal ligament, okay, keep that in mind. So the medial attachment of the flexor, the extensor retinaculum, are triquetral, pisiform and styloid process of ulna, while the lateral attachment is the anterior border, the lower part of the anterior border of radius. This part, the lower part of the anterior border of radius, gives attachment to the extensor retinaculum. Extensor retinaculum has 6 compartments. If you can keep remember it very well. First of all, from lateral to medial, from lateral to medial, you have the extensor carpi radius longus, extensor carpi radius brevis, then you have the extensor pollicis longus, then you have the extensor digitorum, within which is extensor indicis, then you have the anterior interosseous artery and the posterior interosseous nerve, right? Then you have the extensor digiti minimi, and you have the extensor carpi ulnaris, okay. So these are the structures passing through the extensor retinaculum. Not much important, tao bole dina. This is all about your forearm part. Hopefully you have understood, okay. See it in, I think, 1x dekho, yes, for you all to understand. It's a little confusing part, okay, and many muscles, many things told, right? Go through the videos which I have posted, and all the best.